And now we have some awards. You ready? Yeah, okay. Every year at this conference, we have some Health and Care Research Wales awards, and they are about celebrating achievement in the research community over the last 12 months. And we've got 4 awards to give out: Public Involvement, Impact, the Rising Research Star, and Innovation in Practice. Plus, we have an award for the best engagement for one of the stands in the conference today, and I think people have been voting for that over the day. Lots of thanks to everyone who entered for the awards. There was a really high standard of submissions. We had a number of judging panels who judged those submissions, and the people who were submitting all provided a short video as part of their submission and contribution. Also, thanks to the panels who spent a lot of time in trying to make some very difficult decisions. The winners in each of the awards get £250 of funding for them to go to a training course, conference, workshop, or whatever to further their research skill set and career. If you want to, during this, you can share your congratulations with the winners in the chat box and also on social media, as I'm sure you have been tweeting away all day. So, without further ado, to the first award. My understanding is, by the way, I don't think the award winners know that they are getting an award. So, first award is the one on public involvement. And it recognises people who have used great strategies for public involvement, who use the UK standards for public involvement in research, which incidentally, Wales was a leader in developing those standards. So this is what the judging panel said. The winning application was exceptional, clearly meeting all 6 UK standards for public involvement. The panel was especially impressed by the innovative involvement methods, such as interviews and focus groups. The submission showed a strong commitment to inclusivity, engaging a diverse range of organisations, and the use of British Sign Language was a standout feature, promoting even greater inclusivity in shaping the research. The submission also provided clear evidence of the positive impact public involvement has had on the project, and the panel appreciated the depth of the work and praised the excellent video, which was easy to understand and showcased the meaningful impact already visible in healthcare. It was very well deserved. So the winner is Kathleen Withers from CEDA at Cardiff and Vale University Health Board for her work on the People's Experience Survey, which supports service improvement work in NHS Wales. So let's first hear from Kathleen, because we're going to play the video, while she comes up to the stage, and we'll congratulate her when she gets here. So shall we play the video?
Project worked with groups across Wales to create a national People's Experience Survey suitable for the use in any healthcare setting. As a People's Experience project, the service user input was essential in developing a survey that was meaningful to people across Wales to support service improvement in the NHS. The final validated People's Experience Survey will be used across NHS in Wales to collect real-time experience data to drive service change and deliver equitable and quality services to our communities.
As someone living with a rare chronic condition, it has been incredibly rewarding to work with different groups, be heard, and collaborate on the development of this important survey, which aims to gather feedback from people in Wales, improve our health service, and make a difference.
The money comes later. That's great. Well done. Right, our second award is the award for Health and Social Care Impact. And it's about, research that really makes a difference and the differences that makes to people's lives. So on this one, the panel said, again, I'll read what the panel wanted to convey. The panel was encouraged to see the breadth of research taking place and the impact and influence it could have on patients' practice and policy in Wales. The winning application showed impact by using an unexpected outcome of the project to help teachers deliver lesson plans in secondary schools and the impact that it had on support for oral health. There was clear evidence showing collaboration with young people and parents that helped to shape the project, and the winner is Nicola Innes and the Bright Trial, and we're going to watch the video.
Bore da. I'm Nicola Innes, and I want to tell you about an unanticipated beneficial output from the BRIGHT trial, an NIHR commissioned school-based randomised controlled trial. The trial tested mobile health to support positive toothbrushing behaviours in young people aged 12 to 14 and reduce tooth decay. The intervention had two parts, a school-based lesson followed by a series of text messages sent to the pupils' phones. Rather than the results though, I want to tell you about how we used part of the trial intervention, the school-based lesson, to achieve impact. The lesson was iteratively co-produced with teachers, other school staff and pupils, and received positive feedback as part of the trial process evaluation. Now, oral health is a required component of the curricula in Wales, so we placed this endorsed downloadable lesson plan and resources in Welsh, but also English, on the Adiseg Cymru Hub. It's been downloaded over 200 times since June. So, although it wasn't directly related to the trial's outcomes, it offers a user-endorsed evidence-based lesson for teachers to deliver easily to pupils and support toothbrushing behaviours to reduce tooth decay and its impact. Thank you.
So Nicola's colleague Heather is going to collect the award on her behalf. You're welcome. Right, our third of the 4 awards. You can tell it's not the Oscars, can't you? The next award, this is one I'm always really excited by. It's the Research Rising Star Award. And, you know, you could tell I really care about the Health and Care Research Wales faculty and the future careers for researchers. This is about finding a researcher who's in their early stages of their career, is making a significant contribution, and who's an emerging future leader. One of those people I referred to who's going to be there in 10 or 15 years' time, leading research in Wales. The panel was really impressed by many high-quality submissions for this category. There were a lot more submissions than last year, and it shows how many great early career researchers we have, and they said the decision was really difficult. The Rising Research Star panel commended the winner's innovative and impactful programme of research, which is funded by a prestigious Wellcome Trust Career Development Award, a really great commitment to diversity and inclusion and support of the wider research community, which is going to be inspirational for the next generation of researchers in Wales. And the winner is Samuel Chawner, and again we're going to listen to him briefly and then give him the award.
Hi, I'm Sam, a research fellow at Cardiff University. My research focuses on understanding the causes of mental health problems in children and young people. Recently, I received the prestigious Wellcome Trust Career Development Award, and my project focuses on identifying the risk factors for developing the eating disorder, avoidant restrictive food intake disorder, abbreviated to ARFID. To achieve this, I'll use large-scale data sets and work with individuals living with ARFID. You may not have heard of ARFID before. It was introduced as a diagnosis in 2013, and there's currently a lack of research, despite it being a serious condition affecting 1 to 2% of the population. As part of the fellowship, I'll work with the NHS to develop the first national clinical guidelines for ARFID in Wales, and I'll work with the Psychiatric Genetics Consortium Eating Disorder Group to disseminate my research internationally.
Everyone loves watching their own videos, don't they? We're on to the fourth of the 5 awards, which is the Award for Innovation in Practice. It recognises the value teams and individuals have made to their field of practice. And the panel, again, this is what they said. The application was very impressive with clear impact. It clearly outlined what the team is doing, how they've achieved it, and how the impact it's having now and in the future, and the plans for spreading this work across sites in Wales. It was also very positive to hear about Wales developing capability for first-in-human trials, which is extremely important. And so the winner of the Innovation in Practice Award is Orad Ersenlw from the North Wales Clinical Research Facility team for his work on setting up capability for first-in-human trials of investigational medical products. Now, Orad can't be here today, but we're going to have him on screen for a moment, and I think one of his team is going to come up to pick up the award.
Hi, my name is Orad Ersenlw. I'm a consultant physician and the director of the North Wales Clinical Research Facility, a dedicated unit specialising in the delivery of early phase clinical trials of experimental drugs. Following large-scale successful phase 2 and 3 studies, I've developed capacity to deliver first-in-human clinical trials in North Wales. These trials are being undertaken in humans for the first time ever and bring higher risk than most other trials. How did we do it? In order to achieve this, I set up the North Wales Experimental Medicines Group, a first ever in Wales. The MHRA regards an experimental medicines group as a vital component for first-in-human research governance in order to deliver research safely for patients and participants. Why is this important? Very few first-in-human studies have ever been undertaken in Wales, and none outside of Cardiff. This has allowed us to undertake the first-in-human Empower study, a vaccine which has to date been shown to be safe and efficacious against a virus that was declared a global public health emergency after it caused an outbreak in over 110 countries in 2023. How about the future? We're now looking to attract more first-in-human studies to Wales and expand early phase capacity in line with Wales's response to the O'Shaughnessy report. Furthermore, our experimental medicines group can deliver research governance across Wales and bring more first-in-human studies to other sites in Wales. Thank you.
And the final award is the one people have been voting for today, which is one of the stands. So obviously we don't have the video for that one. It has been great to see the exhibition. I think one of the really nice things about this venue is having the exhibitions mostly in the same room as here, so people have been able to mill around and look at all the stands and vote for them. And the winning stand this year is the Wales Gene Park again. And I think someone's attempting to summons them from the back of the room. Yeah. Do come up. We're going to have a shelf full of things. So that's the moment where I drop the mic and hand it over to Lorraine again.